Caring for another person is the best job in the world.
And being cared about simply makes life better.
Caring connects us and gives us hope.
And comforts us in our most difficult moments.
Good care enables us to get up and push forwards.
Join us as we share
What
Does
Good
care
look like.
And if you want a regular dose of good, subscribe so you never miss an episode. Welcome. It's lovely to have you here.
Thank you very much
for coming after a busy day elsewhere.
Yes.
When I've seen you speaking at various events and talking about what you do at the National Care Forum, you often talk about the importance of not-for-profit,
Yes.
and how important that is to the social care sector. Why do you feel that strongly?
Well, for me personally, not-for-profit, working in the not-for-profit and charitable sector is all I've done all my life in whatever guise of, whichever element of work I've been involved in. And I think that's because of a number of areas. One is the sort of very strong kind of value base that sits underneath it. So you're absolutely committed to delivering against generally a sort of charitable mission or purpose. So that's usually about trying to address social inequities of some shape or form, whether it's around poverty, whether it's around the position of different groups of people in society, whatever. So I think those kind of mission sort of elements and values are a really strong driver for me. I think in the context of the social care sector, actually not-for-profit provision plays a really important role. Often it's organisations who are addressing and working with specific cohorts of people that others are not so interested in. So a lot of my background work has been in homelessness and supported housing, where you're dealing with and supporting people that society hasn't generally got a huge amount of interest in or time for often, but the charitable and the not-for-profit sector will often work in that space. Often they are able to galvanise communities and societies in ways that other organisations are not able to, so perhaps through their use of volunteers, perhaps through their integration with faith-based communities, perhaps because of their very specific origin in a local community. They have usually got a board of governance which is drawn from that local community, so there's a kind of accountability that I think is really important for care organisations. And often they've been around and evolved and changed and developed over many years, sometimes hundreds of years, which gives them, I think, a sort of level of certainty and continuity that actually means that they're invested for the long term. So people can look at those organisations and know that they have both delivered and will be delivering going forward for a long period of time. So I think those things are really important. And then finally, of course, a really big issue for me is about what happens with the money.
Yeah.
So in a not-for-profit, you have got that kind of financial commitment, that financial transparency that means any surplus, should there be one, is reinvested back into that organisation, back into that community. And I think actually, when we're talking about the needs of people who are drawing on care and support, I think actually that's a really important message for them as well, to know that whatever service they're receiving is every bit of money that comes in, whether it's from somebody who pays for their own care or somebody who is being locally commissioned, every bit of money that comes in is invested in that service, those people, that community. So I think it's important from all those points.
Yeah. So it's got a very clear mission, but also the money spent well. That kind of a headline. Do you think we're going to head towards a world where that we see policy wrapped around that? Obviously, there's the recent removal of profit in children's services in Wales. It seems to be something that's on the agenda and maybe creeping in.
Yeah, so we have seen some of that in England in children's services as well, not as significantly as in Wales. But in England, we're beginning to see commissioners of children's services talk about what's reasonable in the context of profit making, being kind of clear about their expectations around that. So will we see that happening in adult services? I think we have some legislation that helps us to do that. So we have something called the Social Value Act. We have got some commissioners for example, in Camden, who are working in a way which is around mission-driven commissioning. So we have got some models of it, but I think we haven't yet got ourselves to the place where we're properly recognising that that added value that not-for-profit organisations can bring. So lots more work to do in that space, and I think we have to recognise as a society that the voluntary and community and charitable sector is under enormous amounts of pressure, often because it's working, it's not the only people working in very complex areas, but it's often working in very complex areas, adding significant additional resource from its own fundraising activities or else to bring a greater wraparound service than those that are commissioned directly by the local authority. So if we lose that, and if we lose those kind of properly ingrained community organisations, I think we'll all feel the loss of that.
Yeah, definitely. Do you think it could support a fair pay agreement? Do you think it could be helpful in terms of revenue generation, almost, around the fact that it stays in the system, it stays in that?
So what will it matter to the fair pay agreement?
Yeah, like if we removed profit, for example, from services, and actually we move towards a different model, essentially, would that generate income to support higher wages?
So I think there's lots of things around. There's lots of ways in which you could create greater kind of efficiency in the context of workforce. That that we are as a sector not particularly good at retention. We have large levels of vacancies. We are often utilising agencies, workers. So I think that there are definitely ways in which that revenue that's spent on those kind of workforce activities, recruitment costs, training costs, disruption in services, etc. So I think there's definitely ways around that. Whether sort of greater, I think the challenge is it's a bit like the sort of unrelenting A&E kind of numbers, isn't it? So if you stopped some people going into A&E, would that mean that you didn't end up with A&E costs? No, probably not. No. Because so actually for many organisations, if we can bring more funding in to support people's wages, then there are so many other things that we need to spend that money on. So I don't think it's going to allow you to create surplus in that way. But what it ought to do is to ensure that there is some additional money going into staff pockets. I think everybody's very worried about the level of funding that's available within the envelope, and also how much confidence there is in that being directly put into the hands of the employers, who can then pass it on. So there's quite a lot of hurdles to go through. The bit I think we could see some of that change happen within is if we do move towards a national care service, and that national care service focuses on what's been described as public sector ethos in organisations. So whether that becomes the vehicle where you then do say, either there's a national contract and it sets a rate and it talks about kind of, what's reasonable profit or not.
Yeah, that would make sense. Thinking like more about you and your kind of background, you started out in housing. What have you kind of, I guess I'm always interested in your kind of founding values. What brought you into the sector in the first place? What dragged you in? Because I think there's always a pull, and then people generally stay.
Yeah,
which
is
a nice
pull,
thing,
isn't it? Well, I think the pull is. I worked in a range of different other charitable organisations as well, CAB and Women's Aid and various other things like that. And I suppose the pull is, the sort of the obvious kind of social justice pull. There's plenty of people who are not living the lives that we would wish, whether or not they're receiving care or not. They've got very poor housing, they've got they've had limited access to healthcare, they've had limited access to education. So there's lots of things that are unjust in that way, and I suppose that's part of that appeal, is about doing things that mean people's lives, people have a better opportunity to live lives that society ought to value and see as fulfilling. So I think there's definitely that there. What was the kind of aha moment type of thing? I'm not sure. I think it's a combination of things. I grew up in a family where my mum was an OT. I spent time with her when she was working in large psychiatric hospitals before they were closed down, and I could see what some of that was like. I then did work as a physiotherapy aide in what was called a geriatric day hospital at the time. It gives you the language gives you a clue of quite when that was. So I could see, I suppose I was interested. I think people are so fascinating. So actually the joy of spending time with people and working with them or supporting them or encouraging them, whichever of those things it is, I think is hugely motivating for me. It makes I think it's a constant driver to want to get better, do more, improve things, influence, whatever the words are.
Yeah. I think people, like, in their early experiences, I always feel like people either have a really good foundation and they learn lots and good role modelling, and they think, yeah, I'm inspired by that and that's the way I'm going to head. Or quite conversely, they have a poor experience, which
they want to change everything.
Which they want to change, which camp would you put yourself in?
I mean, I had a very good experience, I think. I had good role models in that sense. I absolutely could see. I mean, I think if you're observant, you can always see that there are people you would rather behave more like. And there are people who, I mean, it's a privilege, isn't it? When you do the sort of job I do, you go and see people in their workplace. You see the people who are drawing on care and support. It's a privilege to spend time with all those people. But there are definitely, in those workforces, there are people who are, and I don't think it's a lack of willing, but are able to bring their whole self.
Yeah.
And I think, you'll know this, that there are so many people who work in the care and support sector who themselves are carers, who themselves are struggling with, mental health, physical disabilities, whatever it might be. So it's not a critique of them, but I think that you can also see people who are able to bring all of their heart, all of their soul kind of to the work, and that's extraordinary when you see that happen.
Yeah, it is. It really is a magical sector, I think, and so varied as well.
Yes.
Yeah.
Yes. I mean, I think it's because you're working with people, the opportunity for that to be different all the time, for that to be fulfilling, I think is really, there's a different, whatever your interest is, whether you like moving from different person to different person, whether you like to work one-to-one with somebody, whether you want to be in a day service where you've got different people coming all the time, but you work with a group of people, whatever you're interested in, this social care has got a job for you.
Yeah, absolutely. And I often hear people saying things like, oh, I couldn't do that, but they are working in part of the sector, but they see a different role as like something that they couldn't do. So it really leans into your skill set and your strengths, doesn't it? That you can,
and I think
you can do the thing you love.
The more we become it's billions and billions of pounds worth of industry. There's people who are involved in building. There's people who are involved in technology. People involved in logistics, data. There's all of those. We need all of those people to be doing those things. And how fascinating to be doing that. I mean, you undoubtedly have met lots of people, I have too, who are entrepreneurs who come into this sector and say, God, I was working for whoever, Kentucky Fried Chicken or something, and I was doing, making money for them, and I don't want to do that anymore.
Yeah.
I want to kind of bring my life experience and my skills into
do something
this
valuable.
world that can do something valuable. And I think that's back to your sort of not-for-profit bit. I think that's, often that's what attracts people into that space, is that they can see that they're doing that, and that is what all of their work will feed into that.
Yeah, absolutely. It just gives a really good foundation, doesn't it, for your value base and your principles, because you know that it's there for that purpose.
Yeah.
So something drew you into the housing world. What was the interest there?
So when I first went into working in housing, I did more sort of training kind of side of things, and it was I think it was really about that being an opportunity to kind of think about the workforce development sort of side of things, which is something which I've remained very interested in. And then at the same time as I moved into housing, there was a very big policy change around supporting people. So I got very kind of wrapped up in that, which was a huge moment for the supported housing, a huge recognition moment, a bit like the sort of what we're hoping will be the kind of Casey moment, in a sense that actually suddenly there was a recognition that if you put money into preventative work, you could actually completely transform somebody's life. We spent a lot of time building up systems that sort of rescue people at the kind of ultimate point of crisis, and the Care Act is a great example of that, isn't it? In a way that we created this sort of piece of legislation that's got multiple layers of access point in it, but in reality you only can access it at the point of really acute crisis. So what supporting people did was try and look at it completely from the other end, and say, if we can get the housing right for people, and we can give them the support they need to retain that housing and to build that as a kind of block for them, we can hopefully mean that they don't move on to more acute services. And in fact, what was intended there was a separation of tenancy and support. So once you didn't need the support, you didn't have to move out the home. You could stay there, and
revolutionary.
It was really revolutionary, because we'd put everybody on this kind of staircase and said, well, you start off in a direct access hostel, and then maybe you'll be in a sort of less shared space, but still temporary accommodation, and you'll have a lease there, and then you might move on to something under short-term lease, and then you've got to go somewhere, and each time you're disrupting people and moving them forward. So I think getting involved in that, some of the kind of international work around housing first models, some of the sort of really interesting stuff about some of the technology in housing as well, where there was sort of shifts around kind of warden controlled, and move on to technology enabled care in that space. So there was lots going on, but a real movement to say it doesn't have to be this way. And I think that's what we are waiting for in social care, in a way.
And do you think housing is pretty core, really, as a foundation for good care and support? Because it's the environment that could or couldn't work for you, isn't it? Like, so often we see placement breakdown, and actually when you look into it and drill into it, it's about the suitability of people sharing that property together and what that looks like.
It's fundamental. I mean, in those kind of Maslow's hierarchies, that kind, shelter is there as number one, and if you don't feel confident about that, or it's an environment that doesn't deliver the things that you need, whether it's because it's inaccessible, or whether it's because you're living with other people whose lives are chaotic, or whichever. There's so many things that kind of cause that. I mean, interestingly, there was lots of research done in that have sort of direct currency today around sort of visits to GPs and things, and many of those, when you boiled it down, was about inadequate housing, and security of housing, whatever it might be, and it's a massive impact on people's mental health as well.
Yeah, and I guess we're starting to poke around that. We see a lot of that kind of connection between health and housing now, don't we?
Yeah.
ICBs are looking into it, taking those kind of stats quite seriously around, actually, if I've got damp, then I'm going to end up in hospital. Like there is a direct route there. Do you think we're doing enough in that space?
Well, I mean, often these things are driven by complete crisis, aren't they? So you've got this terrible situation of the little boy who died from damp. So we now have AWAB's law, and that's absolutely, and that's starting with sort of damp and mould, and then there'll be other elements of poor housing that are tackled in those ways. I mean, the difficulty with approaching things in that way is like, those kind of conditions just lay out the bare minimum you have to do to not break the law. I mean, that's not aspirational. That's just like, these are the things that you, if you do this, you're breaking it. So it is great that we have that recognition. We have known these. I mean, I suppose I hate to get into that space of being like this person who goes, what? This is new, this is not new.
No.
If we wanted to go back to the advent of sort of public health, that was about people often living in completely inappropriate housing that was bringing on kind of large waves of sort of public health conditions, didn't have access to clean water, didn't have access, and we're seeing some of those things kind of come back round again. It's quite, so it's great. We should never look any of these things in gift horses in the mouth type of thing. But it's not ambitious. It's not ambitious for people. Like older people's housing. I mean, I must have sat on groups talking about older people's housing for about 25 years, and we've always said there is not enough specialist housing for an ageing population. There were multiple reports. The Centre for Ageing Better came out from them. Lord Filkin's work. We know that we do not have enough housing for that people will need going forward. We also know that we've reached a tipping point where now more people rent than own their home. But we're not we're not changing things. Government talks about 1.5 million extra houses. I haven't seen the details of the plan, but nobody's very optimistic that older people's housing will be front and centre in that. Yet we know demography is not saying there's more families coming. It's saying there's more older people. And actually, if we learn anything from Japan or Korea or other countries, they're focusing on enabling the housing to be sufficiently flexible and appropriate for people to be able to stay in it as long as possible.
So it adapts around you as you
adapts around
age.
you. It's got sensors in it. It's got, it's. I mean, there was a program again about 20 years ago called Lifetime Neighbourhoods, Lifetime Homes, which was all about building standards, which would enable people to, if they had a disability at some point in their life or whatever, that they could stay in their house. The house had to be built in a way that meant it retained a level of accessibility. And we have happy standards, which are about, because we know if older people, if we build older people's housing, it needs to be in a way that will support them to remain independent. It needs to have 2 bedrooms. It needs to have access to some outdoor space. We know these things. We've researched them. We've set the standards, but we're not forcing people to build in that way.
And is that about policy or maybe it's about enacting policy that exists?
I think it's enacting policy. I think it's probably something about political capital. Who's got political capital? I mean, even as a sector, we're not very good at listening to older people's voices, and that is the group of people we serve the most. We're not very good at hearing what they want, what they've got to say. So once you then get to kind of politicians, they might talk about the power of that vote, but it's very difficult to see, other than pension protection, that seemed to sort of square off the policy arse of that cohort, and it doesn't in any way address the sort of meaningful concerns of unpaid carers, of, there's a lot. I think we could do a lot more as a sector to kind of sit alongside advocacy groups for older people to be really clear about what they want, because that will help actually get us into a space where we know that the social care we develop for the future is what people will want.
And they've got a little bit more self-control in a way of where their care lies, because a lot of people do get into retirement age with money, with a mortgage paid off. Well, certainly of our generation now, not potentially in the future, and then they are choosing where they put that money, and they are consumers of their own care now, aren't they? Generally speaking, people have to pay to start with, at least for the first initial, maybe years of care. So actually, I guess listening to what they want to buy is maybe an important part of it.
Yeah, it's a really important part of it. But also what their experience of once they have bought it, and what they would have wanted if they had all the options available. There's a great organisation that's just developed called WIGO. Have you come across that?
No, not yet.
Called When I Grow Old.
Oh, yeah.
And I'm involved in part of that as well. And I just think it's really interesting, and it's hard to listen to. As somebody who represents providers of care and support, I mean, what's out there is not necessarily everybody's dream situation. So, but understanding, as you say, if people are consumers in their own right, then you have to understand that. I mean, I think the other challenge we have is that we still seem to be in a situation where people don't really know what's available. So they're sort of saying, well, I don't want to go into a care home or whatever it might be. I don't want to go and live in a retirement village because it's just full of old people, or whatever. But these are just sort of they're not really based on a sort of proper understanding of the full set of opportunities that are available.
It's kind of what was rather than what's now, isn't it? Because there are multiple options available.
Well, there always were multiple options. I mean, I think that's part of the picture, but it's very difficult to kind of, where would you go as to get a trusted source of information? Most people, as you say, they'll probably start their journey, or lots of older people would start their journey paying for care themselves. That probably means they don't go anywhere near a social worker. And they might go near a social worker at some point further down the line if their money runs out and they have to have an assessment.
Might do it to start
the child
with,
might do it,
and then they're not eligible anyway, and then they kind of get bounced back.
Which means we build services around what children might want, rather than so
yeah, absolutely. So thinking about the work with the National Care Forum, then, like how it's obviously a membership organisation. You've been there for a decade now.
How did that happen?
You must have been enjoying it. How important do you think it is for care organisations to be part of a membership body, to have that kind of backdrop, or like have someone to...
Well, now you've got me going. Well, I think it's very important because I think it gives you lots of, hopefully, value, in the sense of it's a very complex world we all work in. So there's lots of things that we can, find out once and tell everybody once, rather than them all doing it themselves. So there's a kind of efficiency sort of point of view. What we find with the National Care Forum members is that they're hugely keen on sharing with each other. So there's a chance for peer learning, which is sort of out of this world, really. People are incredibly generous with the information they share and the knowledge that they share, etc. So you certainly get a bit of that. Often there's chances to get involved in things. So we work with loads of different universities doing research projects, which we bring members into. There's an opportunity to, have a say in the policy world, which through the consultations and the way that we can share some of that. There's obviously specialist groups and things like that. So if you work in HR or finance or something, you might be a member of some sort of association of finance directors, but you'll probably go along to those meetings and discover that there's quite a different world that other people are talking about. You need to have something that understands the regulatory environment you work in, etc. So I think that kind of specialist and bespoke connection is a really important part of it. And then I think there is something around the sort of solidarity of knowing that you're part of a bigger movement. It's quite an isolated and lonely world, being a chief exec of anything. I think being a chief exec of a very small care organisation that's trying to sort of meet the needs of a very bespoke community is complex. I think running a very large, some of our members will run organisations over £200 million organisations. That's no mean feat to do that. So the things that we can do to help them to do that in an effective way and to promote the sort of values and the services that they're delivering and the innovations that they're working on is really important.
And innovation is a big part of the National Care Forum, and I think perhaps because it's part of your interest as well. I think you've always had a really keen interest in what's happening in the sector, how to take it forward, future digital, all of that stuff. Like, what do you think? How important do you think your members feel that digital and technology is now in reforming social care? Do you think people are nervous, or do you think they are embracing it and ready for it?
So I think it probably depends. There's always early adopters, aren't there? So the world is full of a group of people who jump and then see what temperature the water is when they get there. But I think the innovation space is one which the not-for-profit sector has been quite keen to occupy for a long time. I think part of that is because it's got that local governance board, it's got that focus on how do we better serve the community in. Often the organisations themselves have had to innovate and change over hundreds of years, potentially. If you look back at what they started off doing and what they're doing now, they're often hundreds of miles apart. Often they now work over hundreds of miles when they might have started as a time. So they've evolved. They're used to innovating in their sort of services themselves. And then I think that they're interested in that journey. It's quite hard to innovate in this sector, and it's quite hard to bring new ideas to this sector. And there's lots of reasons for that. One is the sort of multiplicity of organisations that exist, the different sizes, the different sectors they serve, etc., etc. But also, it's a very highly regulated sector. So there's a real people see a kind of risk. If I do that, will the regulator like it? Won't they like it, etc.? So what we try to do is we try to create a space where those innovations can happen and can be sort of celebrated. And I think members are very interested in that. So one part of the country, working up in the Liverpool City region, where we've set up a test bed in partnership with the University of Liverpool, and we've got 16 of our members there who are really actively engaged in supporting new innovators who are coming forward, and they've got some grants directly from the university, and they're setting up new brand new things that haven't ever been used in the sector before, right from scratch, or they're taking pre-existing ideas and they're remodelling them and reshaping them for different parts of the sector. And our members are working with them to do that. So that's been a really interesting process to sort of say, how can we make it straightforward for you as a provider to test this? How can we ensure that your workforce are involved in it and the people who draw on care and supports are thinking about that? What skills do you need? That's been a really interesting part of the journey. So what skills do you need to do that? So we're doing some, quite basic on the ground, you've heard this thing about Copilot. What does it actually mean? So you're going to try and use this kind of technology. What does that, what will that look like? We're hoping to have a robot soon as part of that. What are the kind of skills and interface with that we will need staff to develop around that? How do you safely supervise a robot? Who can turn it on and off? All that sort of stuff. So that's fascinating. So that test bed has been really interesting to sort of work out and think, how can we try and provide a sort of sense of scale when most areas, most authorities even might have somewhere between 100 to 200 or 300 different organisations in there. And if you're an entrepreneur, innovator, somebody selling something, you've got to go to all of them. So we're trying to say, let's do it, let's bring them together. So that's one area. And members are really actively engaging with that.
I think the partnership work that I'm aware of exists around the testbed. The fact that you've got the city involved, the fact that you've got obviously the care providers and the university to do the research piece, I think that's got a lot going for it, in the sense that, from my understanding, it wasn't just about testing out technology in this situation. It was more about what is the implementation process to this to get it to a point where it's actually commercially viable, as well as working for the people that we're delivering it with.
But also it's a massive economic opportunity.
Yeah.
I mean, wake up, world. We're not the only group of people. We're not the only country in the world that's ageing. So actually,
we're probably not the most escalating in comparison to a lot.
No, I mean, honestly, I was talking to colleagues from Korea, where I think by 2050, 40% of their population will be over 65. 40%.
Yeah.
We're looking at about 25% in that time frame. And that we've had 100 years to get to there.
Yeah.
They will have done all that in about a sort of 30, 40 year period.
And how are they managing that?
Well, they're looking at housing, they're looking at technology, they're looking at, how do you reshape the workforce? But there's the transport, all those things. And that when we were doing some work on a kind of manifesto for new government and things, what the bit that we were saying in the manifesto is we need the government to think social care first before it thinks about anything else, really. Because if we don't get that right for people to, it doesn't matter what kind of transport we have, if we focus our energy on commuters getting in and out of cities or whatever, then we're missing the point, because we're missing if we're thinking about driverless cars and we're trying to envisage it for, people taking pallets of, whatever it is, stuff for shops around the country as our primary well, why are we not thinking about how do we get the person from their home to the doctor's appointment or to the cinema or to the cafe where they can engage and talk with other people, and as a kind of primary driver for it.
Yeah. What kind of innovations have you seen? Are you allowed to share that?
Yeah, we've got the four. The four that no, it's not secret. The four that are kind of been supported with the grants program, they've been announced. So there's one which I'm really excited about, which has come from our Care Innovation Challenge, which is something we run every year, and that's again another partnership. And partnership is a really fundamental part of the way that I like to work. Is that's a partnership between us. We work with the Coventry University, who've hosted us there for 5 years. We work with industry partners who, like yourselves and others, who are interested in thinking about how where we need innovation and how to help people who are wanting to innovate to think, if I'm going to have to market this, I'm going to have to get funding for this, I might have to look at the ethics around this. We can help, we can bring all that towards them. So one of the innovations is something that's in fact came twice to the challenge and was a finalist both times for the challenge, and that's a worn camera which is intended to record somebody having an epileptic fit in order to be able to show that to the medical teams when they arrive. Because the biggest challenge that they had identified by working with people who regularly were fitting is that when the ambulance came, they said, well, tell me what it was like. And if you've been busy supporting somebody, you haven't been observing in that way. So they can show them the film, and that can radically change the way in which they support that individual. So that's being developed. There's something around use of AI through a company called Care Brain.
Oh, yes.
And thinking about how that can be used in different settings and scenarios. There's a rostering system that's part of that, as another element of that as well. And good to get the fourth one will come to me in a second. But yes, so there's so I think
Is there a Sentai? Is that one?
Sentai is in there as well, yes, which is loneliness and companionship.
Yeah.
And then there's other products that we're looking at how we can support those being utilised by the organisations as well. So those have been supported. So they've got access to the virtual engineering centre in the university and various other kind of resources there to kind of help build up those products. So that's one bit of it. And then I think the other sort of side of it is building up the skill base, bringing in where there is an opportunity, others areas, and then the university has an evaluation opportunity that sits alongside it too. So when we can get some of this other sort of bit of it that we need, which is the evidence base. So
you're a very operational membership organisation. There's lots of things that you like. You don't shy away from putting your hand to this and trying to bring this into the sector.
Yeah.
It's really good.
Yeah, and I think we're doing some of that in the skills development space too, partly with the Liverpool work, which is teaching us lots of interesting things about how people receive skills. And what's been great about that, and it is a partnership with the city, you're right, so we've been able to then tap into some digital exclusion funding and resources, and then go and take, so be the only kind of arm who's taking some of those tablets and training to people who are drawing on care and support, to give them access to that, which is traditionally more focused on digital exclusion through poverty or other areas. So that's been great to just have that kind of practical engagement.
And it's joining all the dots, isn't it? Like that, those partnerships, having everybody in the room talking about it, are those opportunities where you can hear, and I've been in NCF, forums and part of the steering group and stuff for the Care Technologist role. And actually, when you have everybody sat round, they pick up and think, do you know about this thing? Have you been down here? And I see lots of that going on, which it's really good. It kind of knits it together so that there's no gaps that, or opportunities that are lost really along the way.
Yeah, and I think, we can only be that kind of hands-on group because of the members. That's the reality, that they, if they weren't interested in developing care technologists or feeding into training or, we couldn't do it.
And I guess this is the way that you can bring together the shared knowledge of all of the membership, the shared experience, the best practice. How can we get together? How can we work together to bring up our sector?
Yeah,
in really kind of practical ways.
I think so. And that, then we can obviously use that to influence policy development, because we could say it's possible. The worst thing would be is if in government there was a kind of presumption that this was a sector that couldn't innovate or change.
Yeah.
And I know that sometimes sits, people say, well, there's too many organisations, too many people to influence, too many, it's too difficult a beast to move. No way. It's, if you think about the people that Care supports now compared to perhaps what people were doing 10 or 15 years ago, the complexity is more, the expectations are higher, the skills we need in terms of technology are more, the regulation is, it is definitely a sector that changes and moves. And I think it's quite hard to get politicians and policymakers to recognise that, but it's also quite hard for us as our sector ourselves to do that.
Yeah. So it's only by coming together that we've got a really unified voice, really.
Of course, because I think that is as I say, that's something I'm very interested in, that how we work together, how we strengthen our hand through partnership.
Yeah, and you can see that through all the different projects. So one of those projects is the Care Technologist role, which is very exciting. So I think that's just another example, really, of saying, right, we know technology is coming in. We know it's an expectation. We know it's happening in different pockets, in different ways. How can we standardise this? How can we support the sector to deliver this effectively across the board? So maybe tell us a bit more about that.
Yeah, so that's exciting. It's a really exciting project, as you say. I mean, shamelessly, well, not shame, no shame at all attached to it. We work very closely, again, with colleagues across the UK and in Ireland as well. And through that partnership work, I became aware, certainly, of some work that had happened in Scotland, where there was a sort of future vision of what what do care roles look like in 10 years' time or 5 years' time. And one of those roles was a care technologist. And so this was very much recognising, probably 5 or 6 years ago now, pre-COVID anyway, that actually there would be people who were going to become more and more reliant on technology.
Yeah.
And if we wanted to utilise that vision, then we needed to make sure that it was that the care sector and care workers could also use that as well. And then there was, you remember, Martha Lane Fox had a think tank, didn't she?
Yeah.
And they did a great film about what future technology use might look like. And I just thought that was just fantastic, because that showed you somebody with a remote door opening and driverless car that came to pick them up, but it also showed you when those things didn't work, like just how trapped people could be,
almost prisoners of their own house.
Yeah.
Because
what could make you independent could also really minimize. So you need somebody who can come and integrate those things, talk to them, deal with any problems. So that it struck me that it was going to be a really valuable role. So we have developed that. We've had some great support from the Rain Foundation, which is fantastic, but mostly we've had great support from members, from other experts and stakeholders in the sector who've been prepared to give kind of time and energy to it. We've run 2 pilots of the training now. We've had massive interest from all sorts of different types of organisations. Of course, we found that there were care technologists out there already, but what's been great is lots of those people are now rebranding those roles as care technologists. So we will have a group of people that is recognisable. It's going to now be part of the care workforce pathway. We've been doing some stuff with young people. We went to the Who Cares Wins fantastic conference the other week, and we talked to young people about the care technologists. We think there's another role to come, so very excited if people want to get involved. We think there's another role of a junior care technologist to develop, which would be entry level, so very much aimed at those group of young people who might be thinking, I want to do something with technology, but I don't know what, but I'm interested in people. I want, there's a bunch of very philanthropic, mission-driven young people out there who I think we could encourage to come into the sector through that kind of role.
Yeah, I think you share my kind of vision, really, to really push the idea that this is an exciting workforce. It's an exciting place to work, and it's an exciting role to have. And bringing young people into our sector is fundamental now, isn't it? Like, we need to do that, and I think we can do that through the kind of tech, data, digital-driven roles, the remote monitoring roles. I see a world where it's actually quite an exciting job for a lot of young people to have that connection with people where they are checking in on somebody, making sure they're okay, but actually they might not be as attracted to maybe personal care or other tasks they're associated. We get that feedback, don't we? So I think there's a space for making very exciting roles.
But I think the other bit that goes with that, and that's the other side of it, is we do also need to have that proper conversation about what does all of this mean care will look like in 3 to 5 years' time. I don't think it's much further away than that, which actually means that there's also, we can attract new people, and we also need to reskill the people we've already got so that they're not afraid of this change. And that's been the great bit about Liverpool, is because we've been able to give some of those people some of the quite fundamental digital skills training, they are much more confident about their ability to work in that environment, whereas otherwise you just are faced with people who are a bit like, that's going to take my job. I don't want that there. That's going to take the person away from me, or that's going to get in the way. So I think we've got, but we do have to model out what everybody, for example, having virtual care first might look like. What does it do to the workforce? Or how does it change patterns of work? If we've got great different examples. So we've got sort of what's happened in Shropshire with the virtual call work, where care providers have been engaged with it, versus some other areas in the country where it's been another technology agency who's put the kit in, does all the virtual calls, it's completely detached from care, and and then care comes in and helps somebody maybe at the beginning of the day and the end of the day, and then everything else is, so the continuity issues get interrupted.
Can you see that actually there's a preference for integrating it into current care models rather than having that separation?
Well, I think we've probably got to work quite quickly if that is the preference you want, because I think so I went to the Netherlands, for example, recently, and that was care providers absolutely involved in the delivery of that kind of hybrid care. But you can, what you saw there was nighttime care being monitored for thousands of people with a set of 6 people sitting in a call centre. Now they were the staff of the care organisation, but they could just have easily, perhaps not as effectively, but you can envisage that you could sell that as a model that said, we'll just manage all of that for you.
Yeah, and it sits elsewhere almost. I suppose the thing that you lose in that model is that kind of follow through into the daytime, and what does that look like, and that kind of, we've already got issues with sharing of data, haven't we? Like to kind of create a third separation, another separation where we need to transfer data, and it might be a bit junky and a bit messy. Yeah,
it might be, or it might not happen.
Yeah.
And realistically, and I think we also, it's not that we have done that brilliantly up till now. Care notes don't necessarily always get read in as much detail as they might. There isn't continuity of people. Sometimes there is, and sometimes there isn't. And that's residential or home care. So what is it that it's back to that kind of, what's our vision? What would really good care feel like in that space? Going back to the sort of original premise, are we asking people who are going to receive that what they think?
Yeah, exactly.
Really good. Yeah. Because actually, when you talk to a lot of people who have virtual care, they're massive champions of it. So I don't think we can assume that everybody's going, I don't want to have it because I want somebody to come in and see me. Lots of people don't.
Yeah, I've heard that a lot, and I've heard it a lot that actually just having that safety net and knowing that somebody's there whenever is more important to me than having a visit at a certain time and I have nothing outside of that.
Yeah.
Definitely. Thinking outside your work with National Care Forum and kind of into the your chair role with the Global Aging Network.
Yeah.
I'm making it up now. What kind of things have you seen? We've kind of touched upon international models and stuff. What things are really inspiring you at the minute? I think you spent some time recently in Canada, didn't you?
I did spend some time in Canada. So some great models, great ideas there. So one of the big things, and I'd seen this in Canada pre-COVID again, but now what's fascinating is that the Ontario government has massively picked this up. So this idea of a living classroom. So you instead of sticking sort of health and care development into a college which is disconnected from the experience of day-to-day care, and potentially you have a placement or something which is quite difficult for a care provider to manage, etc. You put the classroom into the care setting, and the training happens there. The people who live there become part of the mentoring. You have a real opportunity to observe, try out things. You could try lifting and handling with somebody rather than a mannequin, obviously supervised. And
day one is a bit interesting.
But you can do all of that, and you're in the setting. You get to know people. You see the difference that social care makes, really good social care makes to people's lives. And that's the hook. That's the bit that stops people leaving. It's because they can see. And the Canadians, when they've done this, it won't be universal, but they generally find that even if people have come in for a health and care course, they are interested in the care. They like the care. They're finding jobs afterwards. They're often the organisations who are hosting these living classrooms will provide them with jobs. They've got a throughput. This just is a great idea. So that's a lovely thing. Easy win. Ontario has put a lot of money into skills development, a lot of money into building. They are seeing that their demographic change is going to have a massive impact, and they're preparing for it. billions and billions of dollars is going into that system. So that's a bit inspiring. I think lots of other things are really interesting around kind of different models of provision. So in Australia, in rural areas, they've managed to create kind of not a small household model. We see a little bit of that here with members of ours like Belong and others, but small houses. So just quite small units for people with dementia, particularly in rural communities. So learning how do they make that work? How does that stack up? Where does sort of technology come into that kind of organisation? Seeing what is seeing some of the things that are happening that maybe we should be, we need to think through the implications. So again, in Australia, they've changed the way that they regulate the workforce. So, for example, people are required to evidence a certain number of time that they've spent with care workers every day. Not the person has to evidence it, the provider has to evidence that time they spent with a nurse. In Canada, everybody has to have a period of time every month with a dietitian. These are things that are not kind of out of our grasp. And of course, they've got some money implications attached to them, but these other countries will do some of this because they think that there is a material improvement in the quality of care for people. The food thing, I think, is fascinating because I don't think we've taken that same scientific sort of, bringing that specialism into the lived environment.
And I guess that's about healthy lives, prevention.
Yeah, I mean, it's regulatory. It's a regulatory driver.
Yeah, okay.
But it's sort of saying it's determining sort of levels. I mean, Canada's gone quite far in terms of sort of being very specific about the types of food everybody's got to get access to every day, and so then one of the things I can do in my role as chair there is I've introduced the National Association of Care Catering here to the Canadian specialists to say, have a conversation. What can you learn from each other? There'll be things here we're doing that I'm absolutely not dismissing the sort of world leading stuff that is going on here too. But that sort of global forum enables us to showcase some of it.
Yeah. Personally, then, just to end, we're all probably inevitably going to experience care at some point in our lives. For you, what does good care look like? What would you hope for it? Because obviously you're coming from a very kind of digital innovation mind. I think you are you embrace that, and I just wonder whether good care for you looks slightly different than perhaps someone who doesn't think like that.
Well, I definitely want lots of gadgets.
Okay.
I'm absolutely convinced that I will. Things like I was in Japan last year. In the public toilets are self-cleaning toilets with a warm seat. I mean, there's something very appealing about that.
Or off-putting, depends how you feel about it.
It's not so nice if it's been warmed by the person in front of you, but if it's warm because it's and if it can clean you like a bidet and dry you, then that for me is like a massive dignity leap.
Yeah.
The thing that people, unpaid carers and people drawing on care and support in their own homes, they don't want necessarily family members to have to be involved in that. And if that is a quick fix, I mean, if you can put it in the public toilets in tiny little villages in Japan, you can do that. There must be a way, the technology must be accessible enough for that to happen. I mean, even frustrates me, and in the UK, if you go into a care home and go and sit on the loo, it's a low seat. It's a low seat.
Or you have the chunky unit ones that nobody could possibly get on, and then they fall off anyway.
Yeah, but you can buy toilets that are not down there. They're up here, and so those sort of, anyway, that's not a gadget. I know it's a toilet, but the self-cleaning toilet, yes, that sort of thing, robots that can help me to I think the big, in 10 years' time, we won't be having a conversation about what car did you buy on retirement. It'll be what robot have you bought to facilitate your kind of independent living at home that can help you to clean and to do various things, go and get your shopping for you, whatever. So I definitely will have that, but I personally don't ever want to live on my own, particularly. I like living with people. I would always choose to live in a shared house if people have me. So I think I'm going to want, my ideal would be the sort of women's co-housing movement type setting, but with a lot of gadgets that would...
Yeah, and a robot.
Oh, definitely. Not just one.
Yeah,
quite possibly several. Yes.
Specialists.
I don't want them to be alone either.
Always thoughtful. Thank you so much, Vic. It's been a really good conversation.
Great. Thank you very much.